Hi there. Welcome to our program today on priorities, which is about our stress management and good mental health. We'll be giving you some simple techniques on coping with stress.
After all, stress is just a part of everyone's everyday life, and it doesn't always have to be such a negative thing.
Oh, that's right. Stress often motivates us to bring peak performance. Think how many athletes you've seen achieve personal bests under pressure.
Or when you're being forced to study for an exam, you actually do learn a lot more than you thought that you would otherwise. Jonathan Duffy caught up with Professor Ron Rapie, who's the head of the Anxiety Research Unit at Macquarie University.
Ron, we talk a lot about stress, but what is stress?
Probably the best way to think about stress is really as a sort of a balance between the external pressures and strains of the world, balanced against the individual's ability to cope with those stresses and cope with those pressures. For some people, that could be a very positive thing. For some people, they really thrive on pressure and get a lot out of it. For other people, even a small amount of pressure tends to go beyond their ability to deal with it or to cope with it. And they then start to have a negative feeling, which they then often refer to as stress.
Do we all respond the same to different stressors?
No, in fact, for a lot of people, having a stress or having a pressure from outside is a real invigorating experience, and they respond very positively to stresses. For other people, even a small amount of stressor outside will be beyond their own ability to cope with that, and they will experience very negative feelings. So really, everyone responds very differently to the external pressures of the world. Probably our coping skills are very important. That involves the sorts of things that go on inside our heads, the sorts of things we say, our ability to deal with external pressures and the way our ability to be able to manipulate them or change them, and generally our feelings or our sense of control in the world, or our sense that we have some ability to change what goes on around us. We are certainly born with some basic abilities, but our coping strategies that we use to handle the stresses around us are certainly things that we learn throughout our life. Some of the sorts of things that we need to learn are, for example, the way that we interpret stresses. Some people will interpret them as overwhelming, whereas other people might interpret them as a challenge. We also learn to develop ways of coping with stresses through physical means, for example, learning to relax or learning to engage in exercise.
Different people respond to exactly the same stressor or cause of stress in very different ways.
When life throws stressors at us, as it does, we usually respond in two different ways.
Yep. We can either attempt to control or avoid the stress itself. But this isn't always possible, especially if the stressor comes from our relationship or from work.
The second way of dealing with stress is to manage our response to it. That's what we call resilience.
After all, it's how we perceive what's happening to us that's causing the distress. And how stressed we feel depends on how we cope with it.
Do you ever think that life is feeling like it's all uphill, like you just can't take any more? This is a good time to just stop, take a breath, and then try and identify what's causing the majority of that stress. But the first thing to do is remember you're not alone. Most of us are living lifestyles at the moment that are just stacked with way too much stress. Jonathan caught up with consultant psychologist Gary Grant.
Gary, as a psychologist, what are the common stressors that you see in your practice?
Well, Jonathan, I think they'd fall into 5 categories. Probably the first one would be those developmental issues. The second one would be relationship issues. A third, financial concerns. A fourth, health. And lastly, work. So, for example, in the developmental one, we're looking at those changes that affect and impact on everybody. Things like leaving school, leaving university, marriage, our career changes, moving from one state to another, redundancy or retirement. Relationships would be the notion of probably breakups with a boyfriend or girlfriend, or separation and divorce issues, or forming new relationships is often very stressful. Relationships that are strained with families, family members and so on. Financial, I guess, would be the notion of not being able to quite afford the lifestyle that you'd like to have, and worries that go with that when you lose your income or one member of your family loses income. Health would be generally those factors that we all struggle with that come on rather unpredictably, where a member of the family is unhealthy, or we might get a particular problem with an injury, something that will impact on our well-being. And of course, work is a major source nowadays. It seems that work is becoming more complicated, more complex, more demands on individuals for working longer hours, and this is incredibly stressful for most people.
How do these factors impact on a person's health and well-being?
Well, how they impact basically is, and this is what I often get people to do, is to try to list and identify the number of sources of problems or burdens that they have, because they're actually really accumulative. And I have a graph on the other side there that actually shows that, and that is, it's looking at the fact that as we increase our level of stress, that has a very pronounced effect on people's well-being and or their performance. So everybody needs a little bit of stress to be motivated to get going in the morning, to feel good about things. Most of us survive extremely well in our comfort zone, but when it goes over that peak, then our performance decreases dramatically, as does the way that we cope and how we handle things.
Now, Gary Grant tells us that stress is cumulative, or it collects over time. I guess it's a little bit like this staircase here. Each step on its own is pretty manageable. Even the first step of the first flight of stairs makes me think I might even enjoy the challenge. It's only when I've climbed, say, 20 flights of stairs that I really start to feel it. My body's aching, my muscles are burning. It's because of all of the impact or the cumulative effect of the stairs that I've climbed before. Stress is a lot like that. You get to a point, maybe it's the 20th stair that I step up and that's the final stair and I can't take any more. Stress is just like that. This is a point where you've got to stop, take a rest, and try and identify just where all that stress is coming from.
It's important to dig right to the root of what's causing the stress. Ask yourself, why am I responding this way? What am I really stressed about? For instance, an anxiety about work may be rooted in a need to feel focused and in control at all times. Stress in a relationship may be a fear of long-term commitment.
Gary, how do we identify the root cause of our stress?
Firstly, I think we have to look at what stress means to people. And if you think of stress as a personal or a real threat on an individual's physical well-being or psychological well-being, it gives us a hint. So, for example, a threat on anyone's psychological well-being is going to be the way that they interpret the event. So the key is, when someone is feeling overwhelmed by a phenomena, is to ask them, what is the meaning that you put on the event? It's always their interpretation of the event rather than the event itself. And that's where we'd start.
Having identified the cause, how do we develop resilience to the stressor?
Well, the resilience to the stressor really comes back, I guess, to the way that in our family that our parents and the family, I guess, helped shape the way that we look at things and our view on the world. So, for example, it comes back to, I guess, modeling from families that can sit down and do some problem solving together, that they can say and support each other through the conflict and uneasiness with a degree of optimism. And rather than define problems as major burdens, we need to reframe them as something that's manageable. They're probably a growth experience, and that we've generated over our childhood and adolescence successes in handling things that are difficult rather than to be defeated by them. And that really shapes a person's resilience.
Sometimes we have to just stop and step back in order to identify the root cause of what's stressing us. But once we identify it, it's possible to reduce the amount of stress we're feeling. In fact, just understanding what's causing us stress can often be a comfort. Then if we can start to turn that stress not into a burden, but into an opportunity, we can put ourselves into a positive frame of mind. Maintaining a good balance in our lives builds our resilience and our ability to cope.
So now we've taken that first step of identifying where the stress is coming from. What next? Maybe you're at a point where stress has just taken over your life, where you're sort of dwelling on all the negatives. Well, let me tell you, we've all been there. Jonathan caught up with psychologist John McEwen and talked about some tips on just how to cope with all that stress.
Well, the first thing we want to do is help people feel they're coping fairly quickly. So we want to help them to deal with the physical effects of the stress and deal with the worst of the physical symptoms firstly. So the first thing is physical symptoms must be dealt with. Otherwise, the distress will interfere with everything else. The second thing is to deal with the strategies to help them make the decisions they need to make to be able to deal with the very problems that have caused the stress. So practical working strategies form the second part of any plan. The third thing that stress tends to have done to people is cause them to lose the plot, lose actually who they are. So they've forgotten who they are. They've forgotten what recharges their batteries. They really have lost that sense of themselves. And so the third aspect of the strategy has got to be to help them to find balance again in their life and identify the things that are going to recharge their batteries and get them back to 100% of the person they should be. So if we go back over those things, the first thing is physical interventions, immediate physical strategies, relaxation strategies, breathing strategies, just to help drop the symptoms of distress. Sometimes medication is part of that if the person is severely affected by what's been happening. So the first thing is physical. We've got to just wind the pressure down a bit so that the person can start thinking again. Then we move to that second stage, which is to help them find practical, working and sustainable strategies to confront the problems that have led to the stress. And once we've got good strategies in place, then we move to the third aspect, which is to help them find balance, which can be achieved each day, each week in their life, so that they're doing the things that make them who they really are. And that means looking at each area of life and identifying what they should be doing. So creatively, how can they recharge their batteries? Culturally, how can they recharge the batteries? What can they do just to feel better and be empowered, be strengthened, get that power, coping power back in their life? Spiritually, what do they need to do to get back on track? Health and fitness, what are the strategies that they can sustain? Not what is something that we like, but what's something that'll work for them. In the family, what are things which are going to encourage them to adopt positive strategies which will backfeed into them more coping power? In the area of intellectual and the professional side of life, what are the things they can do to get their mind focusing again? What are the things they can do to advance their professional life and get the satisfaction which will backfeed? What are the things that they can do to enhance and strengthen their marriage, to get more joy in their family, to look at social interactions which might recharge their batteries? So it's a pretty thorough process at that third stage to systematically look at what can be done to fully get coping power back on stream. I refer to it as getting the power points plugged back in and get the current flowing in every sector of life.
You know, a really good way to cope with your stress is actually to reframe your experience with it and dwell on the positive. Don't dwell on the negative. Instead, see it as an opportunity, a bit of a challenge. You can try meditation, prayer, or group support. All of these things are going to help you relax and increase your ability to deal with stress. You know what? Find whatever works for you. And try some of these techniques for stress in the workplace as well.
Ron, what are the common stresses that we all face in the workplace?
There are a great many of different stresses that could occur in the workplace, and of course each one is individual. It could involve difficult colleagues or a difficult boss. It could involve having too much work or work that appears to be beyond your own personal capabilities. I guess what ties it all together is a sense of being out of control. If the factors in the workplace feel like they're beyond your ability to control them or cope with them, That's what really makes people feel like they're under a great deal of stress and pressure. Probably what we need to do is to develop skills and abilities to help us feel like we have more control in the workplace. This can involve changing the way you think about your work or about your workplace so that you feel as if, or you realise that you have more control than perhaps you thought you did. But sometimes it can involve very practical skills of just gaining some control. These can involve issues like learning to manage your time better through simple time management procedures, or learning to problem solve difficult issues so that you can learn to break down problems into small steps and handle them better. Or perhaps it can involve becoming more assertive if some of your problem involves difficulties with colleagues or other workers. Assertiveness is really all about learning to feel comfortable expressing your own needs and letting other people know what your needs are. So to develop assertiveness skills really is going to be very different for every individual, and people need to learn how to express their own feelings and needs in whatever way they personally feel comfortable. For some people that might involve expressing very short, brisk statements like the traditional books have always taught us, but for other people it might just mean expressing things in a fairly quiet way and talking more about their own feelings.
Ron Rapee has raised a really important point. We all feel we need a sense of control, and when we feel we've lost that, we feel stressed. People who use relaxation techniques increase their ability to cope with stress. Relaxation techniques are really just mental exercises for relaxing the body. Anything can help, like listening to music, talking with friends, watching TV, reading, gardening, playing with your kids. It all sounds pretty good, doesn't it? Now, I want to talk about something that we do every day unconsciously and how we can turn that into something beneficial. I'm talking about breathing. Marek Yantos from the Behavioural Medicine Institute of Australia has a fascinating demonstration for us.
Slow, deep, diaphragmatic breathing is one of the best anti-stress medicines available to us. Through respiration, we can impact on the physiology of the whole system. As we breathe slowly, the mind becomes a lot clearer, blood vessels begin to dilate, muscles begin to relax, and our body goes into a restoration state, stimulating the immune system and having many other desirable effects. Most of us breathe at a rate of about 8 to 14 breaths per minute. But unfortunately, as we experience different emotional states, our breathing immediately changes. When we are under prolonged stress and tension, our breathing can frequently move up to 18 to 28 breaths per minute. And as that takes place, we begin to hyperventilate, and that has many negative effects and symptoms. So one of the things that we need to focus on, Joe, is to first identify what is your primary breathing pattern. If you could place one hand on your chest and one hand on your tummy, see where most of the movement is taking place as you breathe. It's definitely in the chest. Yes, as we engage in chest breathing, it is a shallow form of breathing, and the whole rib cage is actually moved up and down through the recruitment of neck muscles and upper back muscles. But the primary respiration muscle is the diaphragm. It lays below the lungs, and for us to be able to activate the diaphragm, we need to engage in what we call effortless diaphragmatic breathing, which means most of the movement should be taking place in the tummy area. So attempt to breathe now, extending your tummy out as you take a breath in, and allowing the tummy to go back in as you exhale. And as you do that, try and eliminate as much of the chest movement as you possibly can. As you begin to develop this pattern of breathing, we need to then focus on the breathing rate. If we want to achieve maximum relaxation and restoration within the body, we need to focus on a breath rate of about 6 to 7 breaths per minute. To make that a little easier for you, I'd like you to focus on breathing in for about 3 or 4 seconds and then breathing out for about 6 or 7 seconds. If you can establish that rate of breathing, that will result in a breathing rate of about 6 breaths per minute. And that is the optimum relaxing breath rate that we want to aim for. And of course, as you establish that pattern, what you will see is that the breath rate and the heart rate begin to synchronize. And of course, heart rate is one of the most important rhythms within our body. It's the rhythm that gives us the best measure of overall health. That breath rate pattern we actually control through our respiration rate. Of all of the involuntary functions within our body, respiration is one that we do have conscious control over, and through it we can begin to impact on all of the other rhythms that are desirable and essential for restoring good balance within the body.
So it's in for 3 to 4 seconds and out for 6 to 7 seconds. You should be feeling the movement in here in your diaphragm. Try and eliminate all of this chest movement. Give it a try, you get better each time.
As well as relaxation techniques, we need to look at our other lifestyle choices to help us cope with stress. Being physically active and maintaining a balanced diet are also important.
Ooh, that looks good.
You recharge your batteries?
Absolutely. You know, I agree with what you were saying. Remember, stress is additive, which means if you're under stress and you fall back into bad habits like eating junk food, it just adds further to the stress load.
And the same goes for your emotional life. Fulfill your emotional needs by socialising, by investing time in relationships, by being an active member of the community, and try to resolve conflicts so you're not just putting more on the load.
Once again, we're back to balance, a balance between work and play, between stress and relaxation.
And this is where sleep comes in. I think we've all related to sleep deprivation, those times when we've pushed too far and ended up losing out on sleep. And then you start losing concentration, you have mood swings, you become irritated, you can even get depressed.
Jonathan spoke to sleep expert Fred Harding to find out more about our sleep needs.
Fred, what is the relationship between sleep and stress? Does stress cause poor sleeping patterns, or does poor sleeping patterns cause stress?
Well, it works in both ways. When we're worried, uptight, and stressed, it certainly influences our ability to get a good night's sleep. There's no question about that. But the other side of the coin is that if we are sleep deprived, we don't have the tools to be able to deal with the stress in a positive way. Stress is our response to the things that are happening around us, and we have to choose those responses. Sleep deprivation influences our ability to make decisions, and it lessens the efficiency and the quality of those decisions. And when we are making choices then, in a tired state, those choices are not as strong nor as good, and therefore we don't have the same resiliency in dealing with the stressful situations of life.
Fred, what is the optimum amount of sleep that we need each night?
We need to be getting between 8 and 9 hours of sleep for optimal cognitive performance. It's generally accepted that if we get 7.5 hours, it's enough to get by on. But that's not optimal living. Now, if we're tired, we may feel in need of a nap. And that's not a bad thing. In fact, it's the most effective thing we can do to restore performance temporarily in an otherwise tired person. But a nap should be the right kind and the right length. A nap should be between 10 minutes and 30 minutes. If we sleep longer than that, we increase our chances of waking up feeling tired. So a nap that is between 10 minutes and 30 minutes is very restorative.
Fred, is it more important to go to bed at the same time every night, or to get up at the same time every morning?
Well, current research would lead us to think that it's more important to get up at the same time. Society today looks forward to the weekends where they can sleep in. And yet it appears today, based on a lot of research, that that's probably unwise. The best time to make up for lost sleep is to do it by going to bed earlier. By waking up at different times, it is like giving ourselves a little bit of jet lag on a daily basis.
Fred, what do we do if we wake up during the night and we just can't go back to sleep?
A lot of people experience that, and probably the best thing they could do is to not fight it in bed. So get up, go to another room where it's comfortable and quiet. Do something that is calm, like reading, and then when sleep comes upon you, return to bed and go to sleep.
In summary, what are your 5 best tips for getting a good night's sleep?
The first is to establish a regular daily schedule. We need to have a regular time to go to bed, regular time to wake up, even a regular time to eat our meals, as well as do other key daily activities. We're creatures of habit, and when we have regularity in our lives, it keeps the whole body in synchrony with the circadian cycles, and thus it makes it easier to have a good night's sleep. Number 2 is we should exercise on a regular basis, preferably every day, and that exercise should be at least 5 to 6 hours before we retire. If we exercise vigorously just before retiring, it'll disturb our ability to go to sleep as well as stay asleep. Number 3, we should avoid tobacco and caffeine-containing products. These things have powerful stimulants that disturb sleep. Alcohol is the most commonly used sleep aid in the world, but it does help us go to sleep. But during the rest of the night, it disturbs the sleep pattern so much that we wake up less rested than if we hadn't used it. So that should be avoided. Number 4, we should have a quiet, cool, and comfortable bedroom to sleep in. And we should remove things like computers and other things that remind us of the daily activities and responsibilities from that room. And number 5, we should establish a bedtime ritual. We're creatures of habit, and it's been found to be very helpful to do certain things on a regular basis that tell the body that it's time to begin preparing to retire and go to sleep. And it can be as simple as going around and checking all the doors and windows to make sure that the house is safe, sitting in a quiet place and having a conversation or reading something, taking a hot bath or shower. All of these things combined establish rituals that deliver the right message to the body that it's time to prepare to go to sleep.
What Fred Harding said about sleeping in is so true. When I have a big crash-out sleep, I spend the day feeling exhausted and wiped out.
Yeah, he said it was kind of like being jet-lagged, but the trick was to go to bed earlier, not to sleep in.
Yeah, well, when you're really tired, you don't make good decisions because your brain's not thinking as clearly as when you're well rested.
So what we need is a good balance of work, rest and play, lots of exercise and lots of healthy eating to help us deal with stress.
An imbalance in your lifestyle is a big contributor to stress and also depression.
You know, most of us at some point in our life have felt depressed, and it's becoming more and more common in today's society.
But there are a few myths about depression.
One of them is that children are not affected. In fact, depression is one of the primary disorders in our young people today. You're more likely to become depressed before the age of 19 than at any other age in your life.
But depression is not something you have to live with. You can get help.
To learn more about depression, Jonathan caught up with Professor Archibald Hart, who's done extensive study on depression and written books on the topic.
Arch, why is it that depression has reached epidemic proportions? What has changed?
There has been a very dramatic change in the pace of life. The bottom line is that stress is very, very much more significant in our lives than it has ever been before. And it is messing with our brain chemistry, with various organs of our bodies in a way that it's very hard to understand. But stress is the bottom line. That's causing an increase in depression and anxiety.
We often use the word depression, but what is depression?
Depression is several things. First of all, it's a sort of a very sad condition. But more importantly, depression is a dramatic change in your energy level. People who are depressed lose their energy. They become lethargic. They don't want to get up out of bed. They don't want to do their things they normally do. They lose interest in things that normally they're interested in. It can be all of those.
How does someone know if they've got depression?
Well, if you were a woman, you would probably know very easily. Because the interesting thing about depression is that men and women manifest their depressions differently. For women, it's all about feeling. Sad, I want to cry all the time, I want to find someone to talk to about it. For men, it's the exact opposite. Men pull away, they isolate themselves. And men don't feel the sadness so much. They become irritable, angry. They want to go and lash out, take it out on their kid, their dog, the government, the world. They get angry. And so for a man, if you show any signs of hostility, anger, you may want to consider the possibility of depression. If you're a woman, you'll know it.
Arch, where do I go for help if I feel that I may be suffering from depression?
The best place to start is with your family doctor. Most physicians these days are trained to recognize depression, and some of them even to treat it. So start with your family doctor. There may be some medical tests that should be done, because a lot of medical conditions can cause depression as well. And from there, your family doctor may refer you to a specialist of some sort, a psychiatrist or a psychologist, for your treatment.
So what sort of treatment would someone get for depression? Would it just be a whole lot of pills?
Hopefully not, because we don't want you to rush to pills immediately. There are several types of depression. If you are suffering from some loss, fired from a job, or recently lost a loved one, then medication isn't going to help you at all. What you need is good counseling. But if you are suffering from the sort of depression I talked about earlier, namely stress, there's too much stress in your life, then medication does help you. And that medication should be started as soon as possible, but should probably also be accompanied by some good counseling. The sort of counseling we recommend to go along with the medication is called cognitive therapy, because it addresses how you think, what's going on in your mind. And the reason why that is helpful is because when you add that sort of therapy, your success rate goes up so that you're more likely to have effective treatment. B, it helps you manage the stress, and it is very, very important that you address the stress in your life. Otherwise, that depression is going to come back again and again.
How long will the depression last once someone begins to receive treatment?
Well, it depends on how severe the depression, but your depression could last a couple of years quite easily. The recommendation is that you take the medication for 6 months, and then have your doctor reevaluate whether it's time to come off it. Very often at that point, they will just lower the dose slightly and see whether the depression comes back. If it does, up the medication again and wait another 6 months. But this sort of medication doesn't kick in immediately. It takes 2 to 3 weeks, maybe even as long as a month, before you will begin to feel the effects of it. So this is a long-term process. This is not something you deal with overnight.
You know, we all feel depressed at some stage. So if you are, don't feel like you're alone.
But you've got to do something about it. But don't let misconceptions stop you. And, you know, don't worry if you're feeling overly sad or discouraged. It's just a result of your depression.
And depression is not your fault, and it can be treated effectively.
That's right. Seek out a mental health professional. Their treatment can be as fast as 3 to 6 weeks.
That's about all we have for you in our program on stress.
And remember, you know, stress is in everyone's everyday life. It's not just going to go away.
What's important is how we deal with it. You probably don't need to make drastic changes to your life, like quitting your job because of stress.
Now, at that point where you feel like it's just all too much, that's the point where you sort of take stock and think about what's causing all that stress.
And once you've identified that, then you can work out strategies for coping with it. Try to focus on the positives instead of the negatives, and you can reframe the stress and even turn it into an opportunity you can benefit from.
Hey, and don't underestimate living a well-balanced lifestyle. You know, a bit of exercise, good sleep, and eating well.
And remember the other two important aspects of your life, the emotional and the spiritual.
Absolutely. See you later.
Horatio.